Hospitals in central Indiana busy taking care of patients with coronavirus. Many people who had other illnesses have been staying away from the ER, and now many doctors are saying they're seeing an alarming trend. Patients finally coming in now to the ER seriously sick because they waited so long to see a doctor. And joining me live to talk more about this, Dr. Louis Profeta, an ER doctor with Ascension St. Vincent. Doctor, thank you so much for being with us this morning. Can you talk? I know you just got off of work late last night, and you were talking to me in the break about how awful the ER was last night. What are you seeing?
Well, we're seeing a lot of illnesses, high acuity illnesses that are really probably a consequence of people not seeking medical care earlier. Things like strokes that are hypertensive in nature, meaning blood pressure has been out of control, leading to brain hemorrhages, congestive heart failure, kidney failure, sepsis, perforations of the appendix or abscesses or cancers, metastatic cancers that probably should have been picked up months ago, that people have just not been going to their family physicians or getting their screening test. Now these illnesses are progressing and getting out of control, and sometimes they're no longer fixable. So it's sad, but we need people to start coming back into the hospital, seeing their family docs and getting their elective procedures done.
So many people were afraid for a number of reasons, right? One, because they thought COVID was spreading all through the hospitals and they didn't want to get sick. What do you want them, though, to know now about, do you have it under control? Like, for example, at the hospital you are, what are you seeing as far as COVID cases there?
Well, we're still seeing COVID. And I admitted a case last night. We're certainly still seeing COVID. We're not seeing it in the numbers that we saw back in March and April, but we want people to know that the hospital is a safe environment, that the hygiene is excellent, that we're practicing social distancing, we have their health and well-being in mind first and foremost, and that they're safe, and that we want them to come in and we want them to get checked out. So even if they can't get into their family physician, come in and see us. Even if it's something, in the past we used to lament over the fact that people were coming in just to get prescriptions refilled and things like that. But if we're talking about medications like antihypertensives or diabetic medications, real vital medications like that, and you have no other options, come in and see us. We'll help you out. We'll help you get access to care or set you up through case management to find a way to help you get your medications filled. But we want people to come in. We want people to be safe.
We have about 30 seconds left, and we've had you on many times, and you've always been very upfront and blunt when it comes to our health. Yeah, and what we can do to be better. What do you want us to know? Have the final word.
In terms of COVID, or just
being healthier and taking care of ourselves?
Well, we can't forget that even in the midst of this pandemic, that we still have our own sort of health and well-being needs to be first and foremost too, because we can't sort of take care of our kids and our families if we're not well. And that means getting out and exercising, eating right, trying to get enough sleep, trying to maybe just tune down our minds a little bit from the stress of the daily news and things like that, and realize maybe it's not as all bad as we think. There is a lot of good out there, and try to breathe a little bit. And I think that maybe all that combined sort of help things be a little bit better for us and for the country as a whole.
Maybe do a little bit what you do, maybe a little fishing as well. Dr. Profeta.
Absolutely.
Thank you. We appreciate it. Now maybe get some rest before you have to go back to work.
My pleasure. Have a good day.
Absolutely.